Mic check 1 2. Mic check 1 2.
Yep.
Thank you, and thank you for joining us again today. Today, I have State Health Officer Alexia Harrist with me to talk about some of the new dynamics we're seeing. But before I begin this conversation today, I want to welcome back the 153rd Airlift Wing, deployed last February, sub-zero day, kids in their footy pajamas, and they're back today, safe and sound. There'll be another group coming in a few days. That's the 153rd Airlift Wing. Welcome home. Just the other day, we also welcomed back around 100 of our 115th Field Artillery Brigade that were deployed across the Middle East, protecting American interests. God bless them on for coming home safe. I have to say, I think I mentioned this at one of my earlier press conferences. This included the HIMARS unit that was able to outperform even the regular Army. That's sort of Wyoming pride, Wyoming performance. And God bless them for being home. God bless them and their families, both groups, for the service they've done to our great nation and the pride that they give our great state. I wanted to provide this brief update on COVID-19 and answer any questions, to talk a little bit about the state's budget, and then open it up. As of today, we've had 1,605 lab-confirmed cases of COVID-19 in the state, with an additional 380 probable cases. There are currently 1,211 recoveries among our lab-confirmed cases, leaving us 371 active lab-confirmed cases. That number bumps up and down, but and Dr. Harris probably can address that here in a little bit. On Tuesday, we had 36 lab-confirmed cases, and there were 24 new lab-confirmed cases reported today. Our numbers, like maybe not as much, but certainly like other places in the country, are ticking up. We're seeing some of the effect of the 4th of July weekend. As I mentioned, I was always concerned about people behaving in a careful and conscientious way. And for the most part, I hope that most people have, but we are nonetheless seeing in places that we haven't seen it before, and an uptick in a number of cases. Yesterday, we also had, sadly, our first COVID-19 death in Sweetwater County, bringing the total number of deaths to 22. Now, I've gotten some email that I really don't appreciate, and I just want to point out that I really feel badly, and I grieve along with their families, any of these people who die. So when somebody sends me a note that says, well, these people are going to die anyway, they're just dying sooner, I got to say I'm offended. And as an American, I think most people are going to be offended by the notion that people should just get this COVID-19 and get out of the way. I'm sick and tired of that. Our country and our nation needs to be open. We need to behave in a way that is conscientious of one another. There is no constitutional right to go infect somebody else. There is no constitutional right that says you can put others in harm's way. So let's behave, and let's be mindful of our neighbors. That's the country I grew up in. That's the neighborhood I grew up in. Wyoming's cumulative positive case rate, that is the percentage of tests that come back positive for COVID-19 over time, has ticked up today to 3%. When we talked about that with the staff a little bit earlier today, we talked about maybe changing the way we're looking at that so we have more current information, and that may change the way that's reported over the next few days. Right now, we're reporting a cumulative caseload, and we know we've been in this for some time now, and it seems to me we need to have a more current bit of information, and so we're looking at ways to report that more accurately. We have updated our statewide COVID-19 dashboard. The categories of new cases and new hospitalizations, this is new, sadly, are now concerning. If you look at our hospitalization rate, you will see it is ticking up, just like it was before. It's concerning. Doesn't mean it's dire at this point, but it's very concerning. And as I said back in April and early part of May, if you break a leg, if you get in a car accident, or as we've seen elsewhere, wildlife-related kind of accident, and you need to get to the ER, and you need to get to an ICU if you have a heart attack, we want to make sure that you have room in there and it's not completely filled with people who have COVID-19. On Monday, we announced the extension of our current health orders through the end of the month. And I will restate that we were well on our way to relieving all of our orders, and now we're seeing these concerning trends. And I think this is related to the people taking a more casual attitude toward what they can do to do the right thing to make sure that we keep our economy open, we keep our friends and neighbors and our grandparents healthy. Over the past month, Wyoming has seen 700 new cases of COVID-19, and our number of hospitalizations is continuing to rise. Now, around us, we're seeing big flare-ups, and that's concerning too. But Wyoming still remains one of the safer places to be. And as a Wyoming resident, as a Wyoming citizen, and as someone who is proud to represent this state, I know we can keep it that way. We do not want to shut down our economy again. It's not going to come from the governor or some governmental order. It's going to come because the entire staff is sick. And as I said last week, we worry if our readiness, our posture to be able to repel China or any of these other countries that might have adverse desires on us, adverse plans on us, if our readiness is compromised by somebody being silly and acting carelessly. Let's make sure that doesn't happen. Let's practice good hygiene, social distancing, and you know what? Wear a mask. Now, last week I got a question and said, well, we've seen pictures of you not wearing a mask. And I have occasionally not worn a mask, and I have occasionally worn a mask. I am wearing a mask much more conscientiously now, especially as I see these cases tick up. Yesterday, the directors of the Centers of Disease Control said it plainly. If we wear a mask, we will slow down this pandemic and allow our businesses to continue, allow our kids to go back to school. We are seeing private employers, and I congratulate them. This is their prerogative. This is their constitutional right. If they say no shirt, no shoes, no mask, no service, by God, I'm going to respect that. And we're starting to see places that are requiring masks. Menards, for example, enacted a mask requirement in all their stores, and Walmart announced today that all its customers will be required to wear a mask beginning July 20th. Now, there are some who want to go argue that point, but let's remember our Constitution. If I have a business, it is my private business, and I make the decision that I don't want people to be in there for a reason that has to do with a face mask, that is my constitutional right. And if you have a problem with that, go sue them. I support the rights of private businesses taking steps to protect the safety of their employees. And I respect the courage of the employees to go to work, and I think people in Wyoming generally will respect those rights. At this time, I'd like to introduce Dr. Harrist to talk a little bit about what we're doing with testing. Thank you.
Thank you, Governor Gordon. A few months ago, when this virus was first discovered and the pandemic began, we took some actions that we never expected. They were hard, very hard, but they helped us slow the spread of the virus and gain some time to prepare. While COVID-19 is still relatively new, we have learned some important things about it over the past few months. What we know now is the basis of our primary recommendations. Please stay home when sick, unless you need medical help, keep physically apart, and wear face coverings when that isn't practical. There are reasons for the things that we ask you to do. We've seen situations in Wyoming and other places that illustrate why. Here in Wyoming, one weekend of failing to physically distance at Uinta County bars led to dozens of cases. Many people were ill, others couldn't go to work because of their exposure to the virus, local businesses were temporarily closed, and some healthcare offices were forced to close, affecting both staff and their patients. It started as a simple thing, but had real impact in that community. A Washakie County nursing home did nothing wrong, but the virus found its way into the facility and 6 residents died. In Billings, right now there is an assisted living facility outbreak involving at least 50 residents and 36 staff members, with at least 8 deaths so far, and they are still in the early stages. The facility had reportedly turned down a state offer of surveillance testing, which may have allowed the virus to spread more within the facility before it was discovered. Simple actions can indeed have devastating effects. Simple actions can also be powerful and effective. 2 stylists continued working in a Missouri salon with symptoms that later turned out to be COVID-19. They each served dozens of clients in close contact situations, but the stylists and their clients wore face coverings. As a result, they didn't spread the virus to any of their customers. Again, following expert recommendations is the path to getting more of what we all want back into our daily lives. I'll now share some information on testing. First, I'll note that the percent of tests that are positive for COVID-19 is an important indicator of how complete our testing is throughout the state, as well as the prevalence of COVID-19 in our communities. Our cumulative percent of positive tests, currently at 3%, has been relatively stable, though with an uptick today over the past several weeks, and shows overall we are doing well with testing. It's also important to look at whether the percent of positive tests changes over time. Our state dashboard shows a rolling 2-week average of percent positive tests. It has been increasing recently as we've been detecting more cases and more community spread. This rolling 2-week average will be an important indicator to monitor going forward. The capacity of the Wyoming Public Health Laboratory has grown. They can process 750 samples a day or more with excellent turnaround times. We are also expanding with other types of testing to boost our surveillance. Looking for cases proactively helps us to identify potential outbreaks at an earlier point, which helps us manage them better. We have mentioned before our testing program intended for long-term care facilities, and that is continuing. We are adding other options that use saliva testing. These will be used for high-risk settings such as correctional facilities. As part of this increased testing effort, the Wyoming Public Health Laboratory has also begun wastewater testing in some Wyoming communities. We know evidence of COVID-19 infection can be present in wastewater, so testing it can give us an idea of whether COVID-19 is present in a community and perhaps how prevalent. This data can be viewed over time and could help determine trends of COVID-19 virus in communities. Expanding surveillance testing with this method and the others we've talked about can help us identify COVID-19 spread earlier, which can inform the distribution of testing and other resources and the measures that we put into place. For this wastewater project, the first stage includes sites that were already pursuing this type of testing with other labs. The plan involves Wyoming's larger communities next, and later we hope to include any interested smaller locations. The laboratory began testing last week, and results are currently being analyzed by Department of Health staff. I know every single one of us hoped a few months ago that we were facing a short-term situation. Unfortunately, COVID-19 remains a serious threat and is simply not yet done with us. The good news is, though, is that we all have the power through taking simple actions to change the course of this outbreak for Wyoming. Thank you, Governor.
Thank you, Dr. Harrist. I'd like to mention that the Wyoming COVID-19 website has now added a map of testing locations around the state on the homepage, and I hope that is helpful. That map was developed by volunteers working with the Wyoming Technology Coronavirus Coalition, and I want to thank them for their work. That map is available at covid19.wyo.gov. Before I switch gears to discuss our state budget, I want to say a few words about schools. I know that many parents and students have questions right now about how school will work this fall, especially those with K-12, even those younger, my grandson, for example, and their parents, daycares, etc. The Department of Education, as we mentioned last week, has been working with their task force and developed the Smart Start guidance framework that requires schools to submit their operational plans by August 3rd. This is no simple matter. It is easy enough to say that we're going to do the X or Y, but when you look at the differences between communities and you look at the differences between student populations, it really makes sense that we have local informed plans that are submitted and referenced. And I'm happy to say that schools have been working on this for some time. Nobody knows, as we've seen, as I said, 1st of July, we were thinking we would be able to announce to Wyoming that there were no restrictions anywhere. People were doing the right thing. Within 2 weeks' time, we saw that we had changes and we had to pause. If you look at Texas or you look at Arkansas, my friend Asa Hutchinson had to make some big changes there. You look at some of these states, they've had to roll back. We certainly do not want to do that. Wyoming has done reasonably well. We continue to stay open. We continue to stay on the right track, but we are concerned. So when we talk about what might happen this fall, it is pretty unclear what might happen by mid-August. But it is absolutely certain that this virus will still be in place, and I'm happy to say the schools have been doing their best to try to address it. I will say that masks probably have a place in schools reopening. Just want to make that clear. Masks will help those schools stay open. Masks will help our kids get back to the classroom where they need to be. And masks will help them get back to education. We won't lose any more of that very precious time. We want our kids to be safe. We want our citizens to be safe. We want our economy to be strong. And we want the next generation to look back on what we've done here today and say they preserved the Constitution, they made sure we were safe, they made sure our economy moved forward, and I'm proud to be an American. Now I want to talk a little bit about budget reductions. Put simply, we don't have enough income. We lost roughly a third of what we count on to pay our bills, every program in the state. 1/3 gone. Last year we had 33 rigs running in Wyoming. Yesterday, at the Oil and Gas Conservation Commission, we learned that we had 1 rig running. Coal, as everybody knows, is under enormous pressure. And so 1/3 of our income is gone. Earlier today I was asked, well, let's just use the rainy day account. That might last for about a year. And then we have nothing to fall back on. As governor, it is my constitutional duty to balance that budget. 33 1/3, 1/3 of our income is gone, and I have to reduce what our expenditures are. I have to cut the budget to make sure that we have a balanced budget. I went out to every agency and I said, we're going to do this in stages. First stage, freeze all new positions, cut all big contracts. We did that. Got big reversions back at the end of the year. Saved us a little bit of time and a little bit of money. Next step was the 10% that we talked about with the Joint Appropriation Committee yesterday. Those are all agency-identified cuts. And the way I put it today, I mentioned several things yesterday, but just ask me what part of government, and I will tell you where the pain comes. Because there is no part of government that isn't feeling the pain of 10%. There's no part of the Wyoming citizenry that won't feel something from this 10%. Our full-time equivalents, our employment at the state of Wyoming in 1998 stood a little bit above 10,000. We now have 7,000 employees. That's the kind of lean government that Wyoming has done. Now, when we met in early January, and in early February, and I gave my State of the State, I spoke about the fact that we were going to have to cut programs because we can't do across-the-board cuts. So I asked every agency to identify those places they could make cuts. They've presented them to me, and I am reviewing those, and we'll have those data available for you to look at. This will be transparent. We're going to put it up on our Wyoming Sense webpage, and you'll be able to look at, comment, and make recommendations. But let me say, 1/3 of our income's gone. I have no way to raise revenue. I have to make cuts because I have to balance the budget. That's the job of the governor. So you'll say, okay, 30%'s gone. You said 10%. What's about the next 20%? I've gone back to the agencies and I've said, okay, if you have to do more, I want to know what those things are, because the people of Wyoming need to know, need to be able to weigh in on what further cuts we're going to make. And we still have 10% more even after that to make up that 30%. And where will that come from? Well, my friends, the legislature mandates a number of things that we must do. And it will be up to the legislature at that point to say, what are the things that we've told you to do in the past that you no longer can do because we don't have the money to do it? So that's where we are, and that's the challenge we have. Now, some agencies, we aren't going to make a full 10% cut. One of those is the Department of Health. There are incredibly important programs in the Department of Health. Another is corrections. Corrections is what our prison system is, and corrections, obviously, also incredibly important. People of Wyoming know that we're under assault by all kinds of forces on our endangered species, on our coal ports, on our fossil fuels. We're under assault on a daily basis from the EPA and others. And we need to have the legal capacity to be able to respond to those things. So the AG also probably won't have to make those same cuts. That doesn't mean they won't have to make them in the future. There are details of furloughs that we revealed on Monday, earlier this week, and we are working on finalizing those. What I said yesterday, or day before yesterday when I spoke to JAC, there'll be 1 day per month for state employees making over a certain salary. That's approximately $65,000 per year. We are asking all of our agencies to ensure that there will be backup so coverage can continue to deliver the services that people expect to the best that they can. And this isn't new for private business. It is new, apparently, for this governor. I'm the first governor in quite a while who's actually going to have to lay off people. Now, I've run a private business. I still run private businesses, and I know how painful that is. I know that. I don't particularly like it, and I particularly don't like the fact that we won't be able to do the things that people count on. But that's our state of affairs, and that's the challenge. Now, one of the questions that's come up occasionally, and I've mentioned it and talked about it a little while ago, was, so if you got to make all these cuts, Why are you out there trying to buy land? Why are you out there trying to buy all this stuff with Occidental? So I'll say, as I said before, we're not using any of the money that would go to pay for any of these programs, anybody's salaries, any of the support that we give to towns or counties, any of the support we give to local entities. These monies are fully within our investment portfolio, and we have reviewed them for their benefit to the investment portfolio. So those are the investments, the money that we invest in stocks and bonds that return between $1,500 and $3,000 typically every year in money that taxpayers of Wyoming do not have to pay. So this Occidental opportunity, under the circumstances that we talk about, as we've evaluated it, will benefit the money that people can count on to reduce their taxes. That's the analysis that we did. We're not taking any crazy bets, and we're not going way out on a limb. What we're doing is making sure the people of Wyoming have the absolute best returns for the most safe types of investments that we can have. And that's what this Occidental purchase is. So finally, let me say that I'm, again, really proud to be in Wyoming. We are perhaps the, what was it, third lowest unemployment and third lowest death rate in our country. That's a nice equation. More people are employed, fewer people are dying, we have fewer incidences of COVID. You can make a difference. You can make a difference in the way you behave. It is about how we behave in these circumstances that will keep our economy running and keep our economy going and keep us moving forward. So with that, thank you again. I'm blessed to tell you that our soldiers are back safe and sound. The 153rd Airlift Wing and the 115th Field Artillery Brigade, God bless them for their work. God bless you for listening, and I'll be happy to stand for some questions.
Governor Gordon, it's Barbara Ann from Bighorn County. I have two questions, one for you and one for Dr. Harrist.
Okay, thank you, Barbara Ann.
First, Governor, is the Wyoming Office of Tourism going to get any of the CARES COVID money for something like a call center for people wanting COVID information before coming to Wyoming on vacation?
Well, thank you, Barbara Ann. That's a very good idea. We are evaluating a number of those types of opportunities. For right now, frankly, with the Office of Tourism, we're looking at what they have to cut. That might actually be a nice augmentation to that. I know we've talked about it before, as you and I have talked, I think it's important that we get people around the state. Going to different counties. Bighorn would be wonderful. The west side of the Bighorns is absolutely beautiful, and we just that's a great idea. So I will take that back to our task force to look at that. Thanks.
Thank you. And now may I address Dr. Harrist?
Yes.
Yes, go ahead.
There seems to be some confusion over the number of confirmed cases as listed by the county when it's compared to the WDH daily numbers. For example, on July 8th, a county health officer posted the number of lab confirmed cases at 76. The stats that came out the same day from your department showed 75. And then the count in that county has continued to grow until it reached 80. But the stats as of yesterday from your department show 75. Today they show 77. There's another example I'd like to give you is sometimes our county public health posts that there's maybe 4 new cases in the county in the morning. But when those stats come out at 3 p.m., they're not included. I am sure that you've explained this all before, but I don't recall it, and I'm wondering if you could explain how this might happen.
Sure. So there are reasons why there could be temporary discrepancies between our website and the county website. We certainly hope that they wouldn't last for long. So if there are sustained discrepancies, we certainly want to hear about them so we can get them corrected. One of the most common reasons is just you reporting, potentially from the providers that potentially a person was tested in another county, and then we later learn that their residence is in a county other than that we were tested, and so we find out that information and we change the county of residence. I would say that really is the most common reason. Sometimes probable cases can turn to either not a case if they test negative, or to a laboratory confirmed case if they test positive. So there are various reasons. Certainly we only report once a day, so counties potentially could report more updated or potentially be a little bit behind where we are in the timing of the reporting, but there shouldn't be prolonged discrepancies, and so if there are, we certainly want to hear about those.
Thank you.
Thanks, Barbara Ann. Next question.
Hi, Governor. Jim O'Reilly, Bigfoot 99 Radio. Can you hear me okay?
I sure can, Jim.
I want to talk about numbers a little bit. And you began the news conference by talking about lab-confirmed cases, and which I kind of refer to as a top-line number. I'm looking at active cases, which is the number of lab-confirmed cases minus the number of recovered cases. And based on the numbers posted at the Department of Health website and cited at recent news conferences, that trend line of active cases has been trending downward throughout July. First, the number of active cases in Wyoming was 417. On Monday of this week, it was 414. It has continued to go down. Yesterday, it was 405, and today, based on the numbers you provided at the top of this news conference, the number of active COVID cases in Wyoming is 394. Is the number of active cases in the state a useful trend number to look at to give us some idea of the progress of this virus in the state? And if it's not a useful number to look at, please explain why not. And that's a question for both you and for Dr. Harris.
Sure. Jim, thank you for that. And I would, as I said in my comments, that number bounces around. What was concerning to me, and Dr. Harris can look at this differently, is that we started July, right around 200, 250, 260 cases. It then bounced up to pretty close to 400. And that was concerning to me. Now, on a daily trend, it's changed a little bit, and as you smooth those data, I think you are correct in saying the number of active cases changes. That largely is a function of the recoveries that we're seeing in places, and I think also a little bit of noise, as we've talked about right from the beginning, that is around the testing data and the results that we see. So if you look at those trends, my concern has been we have ticked up pretty substantially over the last couple of months, and that's going to happen. I understand that, but I don't want to see it get out of control. I don't want to see what happened elsewhere. And that's one reason why I mentioned that. Just in passing, before I turn it over to Dr. Harris, Jim, I want you to know I've gotten a number of emails recently from Wyoming citizens who are saying, I'm trying to go to a camping area and it's filled with people from out of state, from Massachusetts, from Illinois, from California, from Colorado, from Utah. So it's a question you asked maybe 4 press conferences ago, maybe 5. It's a good point, and certainly one I'm tracking. Dr. Harris.
Thank you, Governor. And I'll just add that I do think active cases is a useful indicator to look at. One thing that it can tell you is how many people who are infectious out there in the state that could potentially lead to further transmission. But it is one piece of the whole picture, and so needs to be considered in the context of everything else. As the governor said, there was one point, I think it was in June sometime, that we had fewer than 200 active cases in the state, and now we're double that. So again, an important indicator to look at that has changed significantly over the past month or so. And of course, as part of the whole picture, need to consider hospitalizations, which has been a concerning trend, as we've noted in the metrics over the last week or so, and have increased as well.
Thank you for that. Just one follow-up question, Dr. Harris. It's a question about the positive lab-confirmed cases that are reported. And are false positives reported as lab-confirmed cases?
So that's a good question. With the type of testing that we are doing, the vast majority of tests are molecular PCR-based tests. The rate of false positives is expected to be very low. However, we have had some situations where the initial lab result was in question. We could determine that, based on looking at the laboratory data. And if we determined that that was a false positive and was not a case, we would remove that from the case count.
Thank you for those responses.
Thanks, Jim. Tom?
Hello, Governor.
Oh, okay. There's another Tom. There's another Tom in the room here, but go ahead.
Okay, this is actually Greg Johnson at the Gillette News Record.
Oh, hi, Craig.
Hey, I had one more follow-up on the budget stuff. As we know, the federal unemployment, the $600 unemployment benefit for virus-related job losses expires at the end of this month. With the state layoffs, furloughs, whatever, having to come, is there any way that any of Wyoming's CARES Act disbursement can be used in a similar way, or would those people even qualify under the rules of that disbursement?
Well, so we have put more money into the Wyoming layoff aversion and unemployment programs to try to buttress what we anticipate with the expiration of the federal programs may be an uptick. And I know that doesn't answer your question, but getting to your question, this is the crazy thing about this particular piece of legislation, the CARES Act. And I don't have the 3 citations now, but if it was something that was already budgeted for, we can't use CARES money for that. If it is something you had to do in excess of, because it was COVID related, if it was new protocols, new PPE, working from home, those kinds of things, those we can tie back under the CARES Act legislation and use. Now, we're doing everything we can to mitigate, not only for state employees, but also for private industry and for the workers that we all count on in this state to mitigate those effects. So we'll continue to look at that, but right now it looks a little bit difficult to do anything other than just extend those unemployment benefits, and obviously they would be able to apply under that program. Thanks, Tom.
Taking this time. So I was just wondering, so we've seen actually today, both in Alabama and Montana, we've seen the leaders there implement statewide mask orders. So I guess I was wondering, first, is that an option that you're leaving on the table? And secondly, what would it take for you to seriously consider implementing something like that?
Well, Tom, this is similar to the discussion we had about stay-at-home orders. My faith in the people of Wyoming is that when presented the information they need, that they will be respectful I am not particularly inclined to say, I'm certainly not inclined to do a statewide order. If conditions in a local community or county and those elected representatives really request it, we'll work with them to try to make sure that's a possibility. Now, what's really been upsetting to me is that there are some businesses, and we talked about that have said, we don't want you coming in here, or masks are strongly recommended. And there have been some obnoxious individuals who have gone in and tried to argue the constitutionality of it. And I think that those people ought to read Federalist number 10 or Federalist number 84 and understand really what the damn Constitution said. The Constitution said, if it's my property and I don't want you coming in here without a mask on, by God, we'll fix that. So I think, you know, those Republican principles that we count on are ones that ought to be respected. Thank you. Next
Governor,
question.
this is Joel Funk at the Laramie Meringue.
Yes.
And I couldn't hear Tom's question there. Was that about a statewide face mask mandate?
It was about a statewide mask mandate, and I'm sorry that I should have repeated it. Tom was just saying, am I leaving it on the table? Am I seriously considering it? And to be a little simpler about it, it is, I suppose, on the table, not as a statewide, but as a community and as the need arises option.
Great, and my question had to do with that as well, if it's okay.
Mm-hmm.
I was wondering, the Laramie City Council failed to pass a resolution yesterday, and I know that that would have supported a local mask mandate, and I know Dr. Harris said last week that local government input is important in that decision making, but I was wondering, with the Laramie City Council's defeat of that resolution, does that make it less likely or that a local order could come down? And I guess this question is for Dr. Harris. I apologize, Governor.
Sure. No, I appreciate that, and I'll let her take that. Thanks.
Thank you. As I said last week, certainly, you know, local support for public health actions is important and does, you know, factor into decisions, but so do other things, including public health necessity, the outbreak metrics, you know, public health data indicating the need. So it certainly is one factor, but not the only factor that is involved in these decisions.
And one more follow-up. Do you have any timeline on when a decision will come down for Teton County's request?
Yeah, I don't have an exact timeline. The order is under review by the Attorney General's office presently, and so we will keep working on that.
Thank you.
Thanks. Next question.
Hi, Governor Gordon. This is Seth of the Star Tribune. Can you hear me?
Yes, I can, Seth. Thanks.
Sure. So I have a question for you, and then a question for Dr. Harris. The comment you made at the very beginning about, and I think you were referencing emails, but about, you know, people died and people were going to die, they just died sooner. I mean, that was a really close quote to what a school board member here said. I guess I was just wondering if that was a response to that, or if you were quoting him specifically.
No, I've gotten a number of very strange emails from people that I think, if you met them on the street, they probably wouldn't feel this way. It's just amazing to me. If somebody has diabetes, does another individual have the constitutional right to make sure they die prematurely? I don't see that. But yet one of the letters I got recently suggested something about people got to be ready to meet the Lord and they should do that every day. Well, okay, I do. But I'm not sure that you need to assist me meeting the Lord in that process. I think everybody needs to. I mean, our Constitution was designed to make sure that we ensured the common good, and that's been tested time and time again. Rights do not mean that I don't have any responsibilities. Rights and you can see this in the Federalist Papers, you can see that in the writings of the founders, rights imply responsibilities, and people need to take responsibility. Thanks, Seth.
Thank you. Yeah, of course. Next question is for you, Dr. Harris. So the governor's talked about the furloughs, and I know that's coming down, and I know that's going to impact the public health lab. I wonder if you think that the furloughs are going to impact at all the contact tracing or the public health lab's ability to kind of keep up with this.
So, Seth, we're as I said, we're evaluating the continuity of various programs. We don't want to compromise the public health lab. We want to make sure that it can still provide the services. I have asked everyone across the spectrum of government to understand very much in the flavor of the community I grew up in. We'll get through this together. I think we all need to pull our weight in the boat, and I've asked people to respectfully, try to contribute to that process. With the lab, I think we want to make sure that we continue to have adequate service, that we continue to do a great job. It is getting more important. I think we were just talking about Montana and Idaho and other places that we're seeing flare-ups. Wyoming, we certainly don't want to get behind the 8 ball.
Thank you.
And you had a question for Dr. Harrist?
That question was for Dr. Harris, but so I don't know if she has anything else she wants to add to it.
Dr. Harris, anything she's waving no.
Okay, thank you.
Thanks. One or two more questions? Hearing none? Thank you again. I have a great deal of faith in the people of Wyoming, and I know these are strange times. They're awkward. As I said before, one of the big challenges for Wyoming is so much of our income comes from what's happening outside the state. So I'm particularly disappointed that places like Texas and Florida, California are seeing the challenges they are, because that means fewer people are going to be traveling. And that means less of the resources that Wyoming can provide and that make up our economic, sort of lifeblood, are going to be required. I am happy that even though we've seen some reductions in gas, coal, trona, and other natural resources, we continue to mine well. We continue to have operations that are healthy because people are taking the precautions they need. People are taking things seriously. When I went out to F.E. Warren Missile Base, I'm really happy that our military is taking this seriously to protect our country, to protect our homeland, and to protect our families. I really do believe that Wyoming is uniquely postured to be able to walk through this pandemic with the fewest restrictions, the greatest opportunity to diversify our economy and to grow and to come out the other side a stronger, better state. But it's going to take all of us working together to get that done. And I know right now it's really frustrating. People believe or don't believe, or they want to say this or they want to say that. But these are your neighbors. These are the people you live with. These are the people that your kids will go to school this fall with. Or not the people, but their kids too. But let's work together. Let's make Wyoming better. God bless and thank you.